Everyone thinks science communication is finding that one magical tweet or TikTok that's going to change the world. And that is not how it works. It is repetition. It is, trying to hone your message as compactly as possible, but still retaining the ability to explain to people why they should understand and believe something, not just that they should.
Hello and welcome to Clinical Changemakers. Today on the show we have Dr. Aaron Carroll. He is a pediatrician, professor of pediatrics, the new president and CEO of Academy Health, and a renowned science communicator. Dr. Aaron Carroll, welcome to the podcast.
Hello, thanks for having me.
I really want to jump into your experiences as a science communicator. Obviously, your background writing at the Incidental Economist, healthcare triage on YouTube, books, regular contributor at the New York Times. I wondered, why is science communication so important to you?
I think as a researcher, I had this epiphany not too long into my career that my job was being a communicator and a writer, and I had not really been trained well to do it. I had avoided classes that involved essays or papers in college and, really gravitated toward tests. But I realized I had to write papers now, and I had to write grants, and I had to write talks, and I had to construct white papers and arguments. And I realized I really wasn't very good at it, nor had I been trained to do it. And so I got very intentional about trying to develop those skills because I realized it was massively important. It was the way to get ideas across. There's tons of research that shows that when research is performed, it takes years, if not decades, for it to percolate out into the real world. And a large part of that is because we're just not very good about communicating it. We're not good about explaining it even inside what we would consider the ivory tower, let alone to the general public or those who would implement it to improve health or healthcare. And so trying to reach back for what had already been discovered and bring it forward and explain it to people became my real passion, even much more so than trying to develop new information.
Where did you see that distinction between, often in healthcare and academic circles, the way that we communicate with each other, writing papers, all of those sorts of ways, to communicating to the public? What did you see had to change in the way that you thought about communication to be more effective in those different spaces?
There's a bunch of things. I mean, part of it is just language. The jargon that we use in medicine and in science is off-putting. The way that we write papers is very formulaic, but not conducive to other people's understanding of it. It's almost its own form of elitism in the sense that you have to really train yourself in that way of speaking or writing to even participate in the conversation. But I also think that there's a tendency for scientists to only be willing or comfortable to speak about work or data or evidence if they created it with their own two hands. When you see people give talks about their work, it is very, again, formulaic. It's here's an introduction, here's like a gap in the literature, here's my specific contributions to it, this is why it matters, full stop, I'm out. And that's, unless you're incredibly well-versed in the area in which that person is speaking, you won't even understand why any of this is important. I spend far much more time talking and writing and, doing video about other people's work than my own, because you have to talk about lots of people's work in order for people to understand why it's important or to care about it. But not many scientists are willing to do that. They really think that they can only talk about something if they're the world's expert on it, and if they did the work with their own hands, which leads to a very narrow, strange view of the world that doesn't allow you to put research into context so other people understand if it's important or why.
And I'll just take on that thread a little bit further, is how that research actually translates into activity, right? Translates into a policy change or some sort of new development, model of care or something like that. So I guess we are really limiting ourselves by this approach to being so precise that actually we lose the ability to translate this into the audiences that really matter. And I think as well, some of our training around hierarchy, this person is the leader in this space, therefore they can only speak, or I could not ever speak about that kind of work as well. I think there are a lot of trappings there.
Go even a bit further in that because we only can talk about sort of what we've done with our own two hands, it leads us to often present a really narrow view. And part of that is by design. I mean, I'm also a journal editor. Journals are very much conditioned to say, don't read too much into your own work. Stick to the facts, stick to what you proved. Don't really take it out of context. Don't talk about the future. Don't talk about why it matters. Don't talk about potential implications. Even when they give you a discussion section, it's constantly trying to ratchet it down and be like, you must narrowly focus on your study design and on your research. And that's fine. I get it. I know that, you don't want to over promote or really go too far beyond what you've done, but it's also limiting in the sense that prevents the rest of the world from understanding why they should care, why it might be important, how might it be important, what should be done with it. Almost every single paper seems to end with the, what's the ask, what's the action, and it's almost, we need to do more research. All research just leads to, we need to do more research. Never to like, okay, well, the world might be a better place, and this is what we might want to do differently, and this is how it might be applied. And I understand why it's important to, keep people focused on what has actually been proven in the study, but we lose out on the actual importance of the communication and how it might lead us to make the world better.
There are some fields, some areas where we actually just have really strong evidence right now. And so there's nothing wrong with gathering a bit more, but I think there are certain points where we can say that therefore piece that you've mentioned too. And then the other piece is some of our science communication is a vessel, a invitation, a way to bring people in to the conversation of how you apply a methodology to understand the world a bit better. And bringing people into those environments enables them to be empowered to spend more time there, to enjoy it, to seek out other questions as well, not just a very specific question that maybe is being asked.
And I think it's a true limitation of the peer-reviewed literature in that we hold that up as the be-all, end-all of truth and evidence and science, but it is limiting in many ways. And it is stuck and it favors certain populations and it doesn't leave a lot of room for interpretation and for making the advances that we need to. I don't know that it serves the purpose that we would like for it to serve in terms of advancing health and healthcare. I think it advances the way that we do science at the moment.
When people look at science communication, they may see it as someone who's got a scientific background, going off and doing some writing or making a YouTube channel or what have you. And, maybe I could pick that up on my weekends or I could just give that a go willy-nilly. But it is a science and an art in of itself. What was your journey into this space and what did you learn along the way?
I would say one of like humility. I almost want to say, I mean, I think it's interesting because people, they see you once you've reached a certain level of skill or how far you've gotten along. But when people ask me like, well, how do you, get to do what you do? It started with a blog. I mean, granted, it was the late 2000s. It was the golden age of blogging. It seemed like everybody had a blog, but I realized I wasn't very good at writing, period, full stop. And I'd been reading a couple of books that were arguing the way you get better at something is by practice, first and foremost, and then a little bit of coaching. If you want to get good at playing piano, you practice the piano. If you want to get good at playing basketball, you got to practice basketball. And I realized if I wanted to get good at writing, I would have to write. And so I committed to myself that I would write 800 words a day, every day for 2 years. That was my goal. And I figured by the end of that, hopefully I'd be reasonably good at writing 800 words, or at least better. And I, at the time, the Affordable Care Act was being argued. I'm a health services researcher. I know a fair amount about the literature around healthcare systems and healthcare system reform. And I thought, well, that's what I'll write about. I will write about what's in the news that day, what evidence can we apply, how can we place it all into context. For years, it felt like our readership was in the tens of people. And I can still go back and find blogs that are terrible. My writing was horrible. No, I own the blog, so it's like I edit it sometimes. Like I will sometimes read a bad post and just edit it today, even just because I can't take it. But it was a long, hard, slogging road of, grinding it out. Sometimes wondering if anyone was reading it at all, and trying to get better in public, which is, again, its own lesson in humility, because lots of people will be happy to tell you how bad you are at it or how your writing and your ideas make no sense. We did it for a long time, and I like to think I got better slowly, and then I started writing for some other outlets, and I was exposed to really good editing, which is the coaching that you need. And I kept plugging along at it. And over time, I like to think I got decent at writing 800 words. But it's still limiting in the sense of, like, I'm not going to write the great American novel. Like, I'm not one for metaphor and themes and, flowery language. I think I'm reasonably good at writing 800 to 1,000 words as sort of a scientifically minded audience. And it's sometimes grinding work. Everyone thinks science communication is finding that one magical tweet or TikTok that's going to change the world. And that is not how it works. It is repetition. It is, trying to hone your message as compactly as possible, but still retaining the ability to explain to people why they should understand and believe something, not just that they should, which is why I still stick to YouTube and not TikTok, because I can't explain an important concept and what the data and evidence are behind it, and why this is good data and evidence and why that is not, and how it all fits together in 30 seconds. It can't be done. It sometimes takes more time and the ability to say the same things over and over and over again, and to really reinforce the concepts. Unfortunately, too little of our media allows that. Cable news hits are the worst thing in the world for that. I mean, you're there for like a couple minutes. You might get asked one or two questions max. That's just not how it works, which is why, and I'm not just saying this because that's what we're doing right now, podcasts have become my sort of preferred media that I will do, because it's one of the few times you get the space to really breathe and to answer questions in depth and thoughtfully, and to be able to talk about the whole idea and the rationale behind what you're saying, as opposed to just trying to rattle off a soundbite as quickly as possible in the hopes that someone will retweet it.
What I'm hearing there as well is about building trust, and that trust is through, going out and consistently bringing your A game as best you can into these types of spaces and being that trusted voice. And so the messenger is really important, as well as that message. And then I'm hearing that the medium also is a really important one. And I guess we're in a challenging time with the way that social media is promoting so much more short form content and bite-sized. How do we move through that? What do you see that sort of evolution is in these types of spaces? Because, as you say, it is complex information that can be difficult to digest, but also I think our human brain can't help but have this delicious snack, junk food content that comes at us. So what do we do about this?
My answer has always been to just keep plugging along and, provide an alternative. I think you're exactly right that it is about building trust. One of the key features of the early days of the blog was people would point out where I was wrong, and I would think about it hard. And if I was wrong, I would admit I was wrong. And I would say, okay, you've changed my mind here. Let's move forward. It was always more about trying to get to a better place than about winning. And that gets lost sometimes, I think, in today. But it was also about, constantly coming back over and over. This is why I'm saying what I'm saying. Not just believe me, or not let me find a snappy way to slap someone around, but let me truly explain to you, the foundations of why research matters, how it is done properly, what progress looks like. And then really trying also to engage and answer questions, not just to deflect and get around it and get to my point, but, truly to answer as best I can and to say I don't know when I can, and then to talk about what we would need to figure out in order to know more. Then to look for that data and evidence, and if not, we can generate it. But a lot of it, again, is it's not about winning. I think it's more about trying to engage in an honest way to get to a better place. So my goal is better health and a better healthcare system, not getting there in a certain way, which I think does separate me from a number of advocates. But it's also, it's the metrics that matter. Like I don't grade it by the number of views. I don't grade it by the number of followers. I don't grade it by, the number of clicks. It was much more always about the quality than the quantity. And so much of it was about building that kind of trust in an audience so that you always understood why I was saying it. And we could then debate whether the evidence that I'd chosen or chosen to highlight is correct or incorrect or what we would do about it. But at least people would understand the foundations and where I was coming from, which would allow us to have more of a dialogue. And I think, again, all of that is it has to be done retail, and it has to be done over and over again with quantity as well as quality time, and a willingness to engage. And that is very rare, unfortunately, I think, in a lot of communication, certainly science communication these days.
Listening to your story, it sounds quite organic with how you thought about what you wanted to do and how you set out to develop particular skills. I wondered, for various institutions, health systems, if they are looking to try to build up this capacity and capability, what would it look like for them to, I don't know, provide education or opportunities or an on-ramp for people who are early in their career who feel like this could be something that they spend a lot of time on?
I mean, I think that there's a lot of, people try to pull it off in like workshops or, quick classes and things like that. And again, I'm going to bring it back to the same argument I made before. You wouldn't tell someone, oh, you want to play piano, go to a workshop, or you want to play basketball, go to a 2-day camp. And then all of a sudden you're going to play basketball. Like you can learn the foundations that way. You can learn some of the fundamentals, but you've got to go out and practice it and practice it and practice it and have coaching for people to tell you where you might improve or where you need to focus. It's hard. And it's like, just like anything else, you gotta really grind it out to get better at it. I think too many people are offered science communication as an add-on or like just something you just throw in at the last second or something you'll pick up easily. And it is not. I've probably written 1 million words at the Incidental Economist before, moving on to something else. I know authors. I know people that have written books, and the number of novels they probably have written before they get one published. I mean, full-on novels can be legion. It's hard. I never want to minimize it. It is work. Just like it takes years to learn health and healthcare, just like it takes years and more to learn research. It can take that long, if not more, to develop these skills as well. And so I encourage the creation of infrastructure and courses and learning and all of that. But I also think that we should be honest about, people that really want to get into it. You need to really commit, and you really need to work, and you need to be willing to expose yourself to others who can provide you advice and coaching and really help you build those skills in ways that you won't get by, spending 1 weekend a year doing it.
Now, I wanted to shift into some of the topics that you've covered over the years, particularly themes around myths and bias. Now, it's very easy in healthcare spaces for us to point at the public about particular myths that are pervasive, but actually clinicians, academics, we can all be subject to myths and biases as well. And I know you've done research around sort of clinical decision support, and I know there's a very loose connection there, but how are we also exposed to, as healthcare professionals, these types of myths and biases? What is it about science communication that can try to undo these powerful methods?
I mean, when I was even a resident, which is sort of, the training that you do after you graduate from medical school before you're let loose to practice, I would say made somewhat of a name for myself in my program because I was questioning everything. I would be told, like, do this. And I'd say, well, why? Why do we do that? Why that many days? Why that test? It didn't always make me popular with those who were training me because it was sort of like, it was often fed back to me as like, well, that's what we do. It's almost as if it's like a journeyman's trade. And what struck me was that depending on who to talk to, you get very different answers. And this was sort of on the tail end of the real evidence-based medicine movement, which is, ironically enough, relatively young still. The idea that we apply sort of math and statistics to the practice of medicine is a shockingly new thing to do. And even if we're not talking about math statistics, just I'd say, like, why do we use this test or that? And the number of times when I wouldn't have an answer, so I would go back to the literature to look it up and would find out that the literature says the exact opposite. It was staggering. I mean, and I was appalled by how much we ignored data and evidence and research that had already been done, let alone, it's not that we didn't have it and we were guessing. It was often the opposite. It turns out that this stuff is rampant. I mean, it's rampant in life. It's rampant in sort of what we tell each other about health, but it's also rampant in medicine, in that very, very, very little of what we do is proven. I mean, to the level of randomized controlled trials, let alone meta-analyses, to say, like, this is exactly what you should do. A lot of it is still best guess and art and what we have done before and trying to modify it. That's okay in the absence of evidence, but we should speak of those things with the proper amount of skepticism and humility of, this is our best guess, but we could be wrong, as opposed to, oh, no, this has been studied to death and we know this is true. But one of the problems is that we say it all in the same voice and the same tone, especially in medicine. Of like, I'm telling you what to do and this is what you should do. When sometimes it's, okay, no, like, you're having an anaphylactic attack, epinephrine, 100%, no doubt, do it right this second, versus, well, maybe, we think that if you eat a bit better that this will happen, but it's probably a really tiny percentage difference it's going to make in your life, and we're not 100% sure, and God, it'll make you miserable. If you want to do it, you can try it, but if you don't, I totally get it. We say everything with the same level of surety and confidence, and that backfires because when we have to change what we believe based upon the newest evidence, or when, the world just all of a sudden decides what we were doing before is wrong, or it turns out we actually proved what we were saying before is wrong, it leads people to question, well, what else are you telling me that you're not 100% sure of? We don't speak with proper level of confidence or not having confidence in what we're saying. And that's a long-term issue that's got to be fixed as well.
I was just writing down the idea of clinical guidelines. When you were speaking about, we speak about the same level of confidence, it's written there, and 4 bullet points down could be another point, and we equate those. It's in the guidelines, therefore they are equally as effective or not. And so that level of being precise about how imprecise we are sometimes is work to be done in the clinical spaces. Coming to your experience working on clinical decision support, ways to enhance clinicians to find or utilize the best evidence, what did you learn in those sorts of spaces?
My goal always with clinical decision support was that, again, it's very much along the same lines we're talking about. If we have gone so far as to really do the research to figure out this is the best way we know to treat something, and then to try to align physician practice with those guidelines so that things become standardized, so that we make sure that everyone is getting adequate and good care, it seems like a no-brainer to me. But one of the biggest things I learned was how much physicians hate it. They do not like being told what to do, and they will rebel absolutely against it, and they will ignore it, and it's not because they're, evil or anything else, but because everyone comes in with sort of preconceived notions of what is important and what they're supposed to do. And there are only so many minutes in a visit and only so much time, and they have an agenda in their head. It always surprised me how even providing clinicians with good clinical decision support and information is necessary but not sufficient. In that it's much more than just telling them what to do and showing them what to do. It often required that same level of almost like detailing and science communication to really get through to them, to explain like why this is important and why we need to do it and why we really should not ignore these things. It's so hard because they will rebel. They will push back against it, and it makes it really hard. It's so hard to get them to do the right thing, and it's so hard to get them to stop doing the wrong thing.
Yeah, I guess I'm also, from what you're saying, drawing some parallels to aspects of public health, where we've sort of viewed point interventions, maybe with a technology or a law or a public health campaign or something, that we say, oh well, we did the one thing, and therefore we would hope that everybody kind of falls in line. And what I'm hearing with the clinical decision support is that, if you're wanting to motivate change in activities or behaviors, it is a package that is needed. Comes back to some of your comments about writing, a repeated, trusted, full spectrum package that is not just in one avenue, but meets people where they are and supports them to kind of move through the why, or that reason for change may come in 5 years' time, not, tomorrow.
I'd also say, like, the trusted voice is super important. A lot of the clinicians that I was dealing with, and I'm a pediatrician, but I practice very little, or I used to practice very little compared to what other pediatricians did, because I was a researcher. And I spent most of my time in research and a little bit in clinical. If I'm being honest with myself, I don't think I was always a trusted voice amongst the other clinicians I was practicing with, because they viewed me as not spending my time, in the field doing what I'm doing. And so, to come down from my ivory tower and be like, this is what you should be doing, I'm sure they didn't believe it. And so we tried to modify things to try to explain, look, evidence says this, this, and this. But even that, it's not enough. It requires really building up those relationships and trust in order to get those bonds where even people are willing to start listening to you, which is why, trusted voices from inside the community matter. One of the biggest things we learned was we set up these groups, these support groups, where we pulled out champions from the clinics and asked them to talk to us about what do they like about the clinical decision support? What do they not like about it? How can we better? Because we needed to get their help in establishing sort of the trust and the relationships that would be necessary in order to even start to work on getting the change that's needed. We don't pay for that stuff, though. We're more than willing to dole out, money like crazy for the technology, but we are not willing to invest in the people, time, and power it takes to get people to want to use the technology or to care about using the technology. And we are so unwilling to pay for the people time that's often necessary to make simple things work. And that is to our own detriment.
I wanted to shift gears to talk about your experience as a regular contributor at the New York Times, being put on such a prestigious paper and such an international paper as well. And I can see potentially, and you may disagree, a shift in some of the writing around COVID and what your focus was. I just wondered if we could spend a moment whether or not there was a shift in how you experienced writing pre-pandemic and then during the pandemic.
In some ways, yes, and in other ways, no. I'd say some of it was more technical. I mean, I wrote for the New York Times at the Upshot for many years before the pandemic, which was technically the news side of the organization, not the opinion side. And I think it wasn't as crowded as you might expect, just writing about sort of health and data and evidence and why they might matter. So I had a good niche, and I, had a good place. As the pandemic hit, it felt like everyone was writing about that. And therefore, it got harder as someone who's not a journalist to do that work, because everyone was writing about COVID. And I had a niche of writing about using data and evidence that existed over here to tell us what to do there. The pandemic was somewhat new. And so everyone was just like, talking to experts and pulling it in. And there wasn't as much space for what I wanted to say, as well as the fact that it was moving so fast that there wasn't as much time to breathe as there used to be. Like a lot of things I wrote about in the pre-pandemic stages were about, papers that have been sitting on a shelf for years, or, something new would come out, but I reach back. Everything was just changing so quickly that it became much harder. And that's when I made the shift to the opinion side. It could be a little bit faster. You could do a little bit more without having everything proven, because we just didn't. And you could hedge. You could say like, well, I think this or I do that, and it became a little bit easier. I will also say that writing became a bit more contentious during the pandemic, but not totally so. People get very angry about health and the use of evidence beforehand too. I used to say all the time that I would get email all the time, writing for the New York Times, where it'd be like, I usually love what you write, except this week when you wrote about my area. That's when I think you're now crazy. And it didn't matter what I was writing about. It could be something about the heart, and I'd hear from the cardiologist. It could be something from the skin, I'd hear from the dermatologist. It could be something about public health, and I'd hear from the public health people. It could be about nutrition, and I'd hear from nutritionists. But people don't like when you bring the lens to them. With the pandemic, it was just a wider group that could get angry, and we were very, very angry. I think the most anger I received about anything I ever wrote was a piece where I was asking people not to be so angry. And they really didn't like hearing that. And I just got, destroyed in social media and everywhere else. So it became a little more visceral, I think, during the pandemic. But health and healthcare have always been somewhat contentious, and people take it very seriously, as they should, and they can get tribal. I've always been about trying to not do that, which can leave you too exposed. But writing for a big platform like that, it's a privilege I constantly value, and I'm always incredibly grateful to have had and continue to have the opportunity.
I was reading through a bunch of your articles and made sure to go sort of way, way back. And going into your comment sections, I agree that there was still a lot of heat that came on for relatively, in my opinion, banal conversations about utilizing evidence, and people would hold it very, very personally. And I think there is something, I guess, human that is consistent across that, around our identities and our egos and our world views.
People have incredibly strong views about artificial sweeteners. Blows me away. Like I just was not prepared for the anger that I would receive for basically saying I'd rather have my kids drink Diet Coke than regular Coke. I mean, people were writing that not only should I lose my license as a pediatrician, but that like CPS should come and take my children away because I allow them to drink diet soda. I mean, even groups came and like subpoenaed my emails because they were sure that I'd been paid by, Big Pepsi or whatever you want to think it is. I was blown away. Like, I thought this was a pretty benign thing to say. Like, look, added sugars are horrifically bad. And so if you got to choose one, I'd choose the diet. But people, my God, like letters to the editor, campaigns, I was totally unprepared for that. And that's hit me a couple of times. Like, people do get very, very passionate about things which I did not expect. And artificial sweeteners, sure, that was one of them.
Now, I wanted to push on a little bit some of the ones that people would think would, be incredibly hot topics to touch, around vaccine mandates, around school closures, masks, all those types of things. What was your experience writing about those? Did you have any trepidation about publishing or concerns about how that would be received?
Well, masking was always complicated because the problem is when people say masks, it means 1,000 different things to 1,000 different people. So like I made some videos at the beginning of the pandemic when we had a true like good mask shortage, and we truly needed the, N95 mask, like the really high end masks for first line responders and people who are like being forced to practice in emergency rooms and everything else. And so when I made some videos saying like, you don't need those masks right now. We're all sheltering in place. We're not leaving. Like, you don't need those masks. Other people need those masks. Don't use those masks. Of course, people then heard like, don't use masks, when it was like, oh, well, now that we're talking about cloth masks to prevent you from giving it to someone else. Yeah, sure. Everyone use a cloth mask. Who cares? But, people heard masks and they took it to mean masks. And later in the pandemic, when there didn't seem to be as much asymptomatic spread, and we now had tons of good masks, then saying, okay, well, you can wear a mask now to protect yourself. And that it just became difficult, and people wanted to fight. And so therefore they would try to pick apart what you said. Now, vaccines, I never really had as much trepidation because probably one of, if not the greatest public health intervention of all time, it's certainly one of them. It's one of the few things that's ever been cost savings as a prevention measure. I mean, they're just massively, massively, massively huge and powerful. And so I'm very pro-vaccine. And I feel like the evidence is behind me, and I could lay out exactly why. But even when you talk about mandate, what does a mandate mean? If some people hear mandate and they think you're going to get the vaccine or we're going to put you in jail. To me, a mandate means let's make it the default, where you should get you should. And if you don't want to get a vaccine, you got to jump through some hoops, not terrible hoops, but some hoops, make it a little more difficult. If we do that, most people get vaccinated. So let's do that. I have no problem with that. But I've done podcasts with people who we've been pro anti-mandate, and then they're like, well, I just don't think people should lose their jobs if they're not. I'm like, who said that? I never said lose your job. I said, if you have a religious exemption or a medical exemption or something, you should have to jump through some hoops to explain why and show, and we should make the default to do this. And they're like, oh, well, if that was the mandate, then I might be okay with that. I'm like, well, that's a problem because we're now not being clear. The mandates I felt like we had at our university, no one got expelled because they didn't get a vaccine. You had to declare your religious exemption, or later just, whatever kind of exemption you had, or medical exemption, in which case you had to get a note from your doctor saying you had a medical exemption, but then you didn't get the vaccine. But by making it the default, the vast majority of people get vaccinated. And we've had incredible success with that in public school and most of the vaccines that existed before. And the ways that we've gotten to herd immunity for most of the diseases that we've really shut down or come close to eradicating is because there are mandates. But those mandates, again, are not you go to jail if you don't get it. It's the default. And so I have no problem defending that. But I have to explain why. And I have to have enough time to explain what I mean by mandate. And I have to have enough time to explain what the pros and cons are and to really get at the answer to that. And that is hard to do, again, in a soundbite, especially when other people are going to try to attack you just to win, not because they disagree. So when I can have an actual conversation and engage with people who are anti-mandate and they're willing to sit down and discuss it, you can often come to a place where there's agreement. It's just that's not how our media is set most of the time.
Yeah, I think that last bit is so important, that actually when you find sitting down with people, particularly, breaking bread, having a conversation, sharing common values, we are so much more aligned on some of these topics. But the information ecosystem is not one that really supports that. And I'd also say busy, complex lives, paying rent, mortgages, double jobs, all of these kinds of life things that come at people make it really difficult to have the time and the headspace to concentrate on these types of issues. And so while, the messaging piece can be done, if we're not making it easy to take the time out to focus on these important topics, we are not doomed to fail, but we're doomed to have a very tough time.
People ask, what do I think the biggest difference that we made sort of at the university during the pandemic? And it was not the testing or the vaccines, and those things were important, but it was we had at least once a week, a 1-hour webinar where we would just take questions from the public and answer them in long form. And we record them so people can play them back later. And I would answer the same question often week after week after week after week. But it was that willingness to engage, to listen, to talk, to build trust, to constantly explain not only what we were doing, but why, to take pointed questions about should we be doing something else? What were explaining that part of leadership is making difficult decisions with imperfect information when no one's going to be happy with your answer. And we pretend that doesn't happen, or we pretend that there's no nuance, that we think follow the science means like it's clear to everyone, there's no question, when that's not really the case. It's imperfect information and there's no clear answer, but we're going to have to make a decision and explain what, and like that was often lacking in public discourse. But we were able to pull that off locally. And maybe that's why sometimes these things need to be more local, where you can have community and you can have sort of shared values and to build up that trust and have explanations. But I think too many people saw this as like, oh, if you just applied the algorithm, you get an answer. That is so rarely the case in science.
And how have you approached when evidence has changed or something has changed? You've written about it or you've done some work in an area and now there's an update that has to kind of occur. How have you sort of responded and been able to navigate that?
As long as you bring a healthy skepticism to the sort of the evidence base that's it already, you're not easily caught off guard. I take nutrition as a good example. The vast majority of our nutritional evidence is case control studies or poorly designed cohort studies. So nothing is rock solid. Like that's where it's like, when they say it's changing, I'm like, no, that's someone's interpretation of the same crap. It just keeps changing over and over again. We should never have had as much faith in it as we should. It's very rare that full-on repeated randomized controlled trials get massively overturned because it just doesn't happen that often. It's usually that things that we promoted as being sure of turn out not to be true when we finally do better designed studies. I think it's important to try to, again, have that healthy skepticism and that uncertainty around what the level of evidence is. I'm quite confident that we're not going to overturn the idea that vaccines cause autism. There have been so many huge, well-designed, randomized controlled trials and all other kinds of studies that show that that's not the case, that even if tomorrow a small study found the opposite, it wouldn't overturn what we've got because we have so much evidence. That doesn't mean you can't keep looking, doesn't mean you can't keep studying the nuances, but we have an overwhelming amount of evidence. We do not have that same kind of overwhelming evidence for almost anything with respect to nutrition. When the guidelines change and when they alter, like, I'm just not surprised. I mean, I have a whole book on that, basically, where it's just like the evidence is not nearly as strong as you think. And therefore, you shouldn't be surprised that people can't seem to agree and that they keep turning it over and over and over again. But it's being willing to talk about our uncertainty and, having that skepticism that not only inoculates us against future overturning, but just prepares people in general for like how science works, which is rarely binary and rarely sure.
I wanted to pick up on one of the pieces that you wrote, which felt quite personal, where you shared information about yourself around health. And I just wanted to ask you, what was it like putting yourself out there, and what was the experience from the readers when you did that?
So I've done that a couple of times now. And what's interesting, again, as a scientist, you're really taught, like, don't use anecdote, don't use your own personal stories. But as a writer, that's how you connect with people. I mean, that's how you get them to listen. So I've always tried to balance the anecdote with the reality. But there are times when it is incredibly helpful because, well, one, I think it humanizes you as a communicator so that people know you're not an automaton robot. Especially because I've had so many experiences with the healthcare system, both as a patient and as a professional. It helps to really show how this is true for everyone, not just for certain people. I have found that the pieces that are personal, like that you're describing, are the ones that most resonate with readers. I will get much more email feedback, people stopping me and talking about it on those pieces than any other. So even though I know it's not what a lot of scientists would advocate for, I know it makes a difference. And I know it resonates. And so I continue to do it. I also I find it to be incredibly valuable. I think that transparency and honesty build trust, and, a willingness to be vulnerable builds trust and builds connection. And walling yourself too much off from that prevents people from developing that connection and or trust that they need to effectively take in the messages you're trying to deliver.
Well, this has been a fantastic conversation, Dr. Aaron Carroll. I really, really appreciated all of your insights. And I'll continue to watch your YouTube channel and follow you online as well. So just a big thank you for all of your time.
Thank you very much. Appreciate it.
And that brings us to the end of the podcast. If you want to go deeper about any of these topics or join in on the discussion, visit our website, clinicalchangemakers.com, or our YouTube channel. Finally, if you enjoyed our work, please give us a rating and share your favorite episode with a friend or colleague. Until next time, take care.